So how do you like the sound of a painless fat-busting laser that also has regenerative benefits? I have come to Reading to discover this new technology with Dr. Bob Khanna, who is a global expert practitioner, and he is completely fascinated by this thing, which is called the emerald laser, and it's by Erchonia. So come along with me, find out all about it, and I'm also going to try a treatment just to, check that it is as painless as everyone says. So Bob, what have we got here? What is this machine?
Okay, well this is the emerald laser.
Yeah.
And this is one of the best devices for fat reduction treatments.
Okay, and it's a low-level laser. Can you explain what a low-level laser is? Because previous fat reduction lasers have been normal, high-energy things that are really uncomfortable, and this one has the benefit of being painless, doesn't it?
Absolutely.
So what is a low-level laser?
We've been obsessed by power.
Yeah.
In all aspects of life. If it's more powerful, we feel that it must be better.
Okay.
Hence why low-level laser technology has not really made an impact in the industry at all.
Because it's been around for a while.
Been around since I qualified. Long time ago.
Not that long ago. And what's it actually doing?
Yeah. So what the low-level laser therapy is working on is non-thermal laser, so no heat generation whatsoever, and it's working at a cellular level to encourage the cells to actually perform in a better way. The photonic energy, the light energy, is absorbed by the cell, creates a photochemical change, which improves the functionality of each and every cell. And this particular machine works on green light therapy, which is the 532 nanometer range, which targets fat cells and creates these little micropores within the cellular membrane, and then allows the content, the fatty content of those cells to essentially be expelled into the free fatty acids and triglycerides.
So this is mainly for fat busting. I'm not that bothered about fat busting, but it's also got wellness benefits, hasn't it? Could you explain a bit about that?
So generally speaking, using visible light therapy of all sorts improves mitochondrial efficiency of each and every cell.
Okay.
And what that means is that energy production value of each and every cell is expedited and actually enhanced. Yeah. One of the reasons we feel fatigued as we get older is because our mitochondrial efficiency reduces as we get older. What this is doing is it's actually not only targeting fat cells, but it's actually improving the mitochondrial efficiency of the cells. So the energy production, the ATP production is enhanced. So what essentially that will do is make you feel more energized, less fatigued, and it'll also have a knock-on effect to other bodily functions. What happens to fat cells over a period of time, particularly with poor dietary choices and lack of exercise, is those fat cells become bloated.
Sure.
And they become lazy.
Yeah.
And they lose their ability to actually deal with hormonal regulation, immune system, energy production, and so on and so forth.
Because fat has a role in all that?
All of it.
Okay.
It's a very important endocrine organ, and people don't realize that. And so essentially what happens is those fat cells become very inefficient. And then by shrinking those fat cells into lean fat cells, as it were, you not only aesthetically benefit the patient, but of course then you improve the well-being side of them as a human being. So all of their bodily functions will improve. And that's the exciting difference between this type of treatment modality and other forms of fat reduction type therapies.
Well, this is very comfortable. I mean, I feel nothing at all, and these green lights are moving in a careful pattern, aren't they? Round and round, and so they're targeting all the exposed area.
So what's actually happening here is billions of photons are being released here. And of course there's a lot of scatter here to target the abdomen as well as the flanks in this particular case. And what this will do is within a 15-minute session on this particular mode will be enough photonic energy to be absorbed by those fat cells to bring about change. You know what, Alice, the important thing about this, there's a cascade system that's available to those fat cells, which means that although we're only targeting the fat in the abdomen and the flanks here, each and every one of those fat cells will communicate to other fat cells in the body and then essentially tell those fat cells to also behave. So there becomes a cultural difference within the whole of the system.
Do the fat cells get so conditioned that they behave better in general?
You can encourage your body, your fat cells, to behave a certain way, which is actually prolonged. And that's the exciting thing about this treatment.
Why are we talking about shrinking fat cells rather than just getting rid of them? This is something we need to talk about.
So for years, we've all been obsessed by just destroying those pesky fat cells, thinking that that's got to be the best way. Just get rid of them and be done with them. Right?
And is it not?
No, unfortunately not. It's not that easy. Your body won't allow you to just simply get rid of fat cells and get away with it. There's a fine to pay, and it's usually in the form of regeneration at some point. There's so much that fat cells are involved with, so many bodily functions that we don't realise, and removing them is just not the answer.
So what are the kind of things that patients will say to you after they've done a course of this?
So after a course, which typically is a minimum of 6 sessions, what they generally say is they start to feel better in themselves, they sleep better, which also means that they become more efficient at burning fat, by the way. So they find their energy levels improve, their libido improves, and of course they start to see visible reduction and measurable reduction in fat.
This is the EVRL,
That's right.
and it's the same technology.
Similar technology
different
using,
light?
so essentially we're utilising 2 other light forms within the visible light spectrum. So we're using violet light and red light therapy here. And the important thing here is that obviously there's pre-programmed presets in this. Put simply, violet light, which emits the highest form of photonic energy, actually targets bacteria and viruses and also fungal infections. So that's really good. For example,
if you had fungal toenails, you
fungal
could
toenail
zap
infections,
them.
for example, herpes simplex, cold sores, this kind of thing. Red light is very good for pain and inflammation.
Right.
So with the various presets that are present, which really vary in terms of frequency and intensity, we can target various other areas of the body.
Okay, so if I've got a sore shoulder or a sore knee,
Correct.
How long does the treatment with that take?
Typically 3 to 5 minutes.
Wow, and that's using red light to bring down inflammation?
Correct.
Okay, so I can't reach my knee at the moment, but I've got a dodgy bit around that bit of the knee.
So why don't we use this?
Okay.
So what I'm going to get you to do is very lightly just move very slowly, like so.
Okay.
Absolutely no pain whatsoever.
No pain, no. So is this sold as a home use device as well?
You can indeed. So typically patients with chronic pain, such as yourself, can actually borrow this machine, this handheld machine, for a period of 2 weeks, and they can use this for multiple times a day to help pain reduction. So there's so much data with regard to this therapy. There's 25 FDA clearances on
Good grief.
this therapy. So it's very well established with regard to the fundamental benefits of non-thermal laser technology.
Now, I'm told you use this on your head or your brain sometimes. Is that true?
It's very true.
Okay, why are you doing that?
very useful if you've got a headache, you're feeling a bit tired. There's actually a functionality here for the head, and you can actually use this in brain function mode to actually improve mitochondrial efficiency, reduce inflammation, and it's very, very effective. Again, I was a non-believer myself until I started looking at the data around this type of treatment. And myself, my staff, they all use these machines with very good effect, and of course my patients benefit too.
Okay, so this is fascinating because it says gut inflammation nerve root. What would you use that for? Like tooth pain or something?
You could use it for tooth pain, but dental pain, that is. But it's also very, very good for, say, herpes simplex viruses, such as cold sores. Okay,
so if I've got a creaky neck, what would I use that for?
I would use this in inflammation mode. So this is what's called the transverse trapezius.
Okay.
And here is the descending trapezius muscle. So these are quite commonly affected in modern life.
Okay.
Overwork on
it just gets completely locked around the occipital bit.
You've been working hard on the laptop.
Always.
It's quite typical to get this. This is very common amongst dentists. If you just move it up and down a little bit there.
Wow.
I'm just going to work some of that sternocleidomastoid.
Okay.
Just twist your head slightly. That's it. And now to the other side. Good. This will improve blood flow, angiogenesis into the muscles, reduce inflammation, and actually help restore normal functionality without any thermal change, which is important.
So that was a deep dive into low-level laser therapy with the emerald laser and with the EVRL. So thank you very much, Bob. That was really, really interesting.
Thank you very much, as always, Alice.